When monitoring therapeutic drugs, the first key principle is specimen collection. We must wait until the drug reaches steady state before we can monitor it accurately. Reaching steady state takes about 5.5 half-lives, and it also takes the same 5.5 half-lives for the drug to clear from the body once stopped. A trough specimen should be drawn immediately before the next dose. This is important because most therapeutic ranges are based on trough levels. Peak levels, on the other hand, are usually measured 1 to 2 hours after an oral dose, though the timing varies for intravenous or intramuscular routes. The goal of therapeutic drug monitoring is simple but critical. Keep the drug concentration in the therapeutic range. This means avoiding concentrations that are too low, which would be ineffective, and avoiding concentrations that are too high, which could be toxic. Each drug has its own unique characteristics: how it is absorbed, how quickly it reaches its peak, how much binds to proteins, how it is metabolized, and how it is excreted. Now let's look at the methods used. The most common method is immunoassay. More advanced methods include high-performance liquid chromatography, or HPLC, and gas chromatography, or GC. These methods allow measurement of both the parent drug and its metabolites. However, they come with disadvantages. They are expensive, time-consuming, and require expertise. Next, consider metabolism. Most drugs are metabolized in the liver and excreted through urine. This means that liver or kidney diseases can greatly affect drug levels. If the metabolites of a drug are active, then their levels should also be monitored. When we talk about antibiotics, therapeutic drug monitoring becomes especially important. Aminoglycosides, like Gentamicin, Tobramycin, and Amikacin, work by inhibiting bacterial protein synthesis and are used to treat severe infections caused by gram-negative bacteria. Vancomycin, a glycopeptide antibiotic, inhibits bacterial cell wall synthesis and is used against severe infections caused by gram-positive bacteria. We must pay attention to monitoring antibiotics for toxicity. Both aminoglycosides and vancomycin can cause damage if levels are too high. Specifically, they can lead to ototoxicity, or hearing loss, and nephrotoxicity, or kidney damage. That is why it is essential to measure both peak and trough levels. Let's look at antiarrhythmic drugs. Digoxin toxicity can appear even when levels are within the therapeutic range if potassium or magnesium levels are elevated. In the case of overdose, digoxin is treated with an antibody preparation called digibind. However, once digibind is given, most assays cannot measure digoxin accurately unless the assay specifically detects free digoxin. Next is quinidine. When quinidine is added to therapy in a patient already taking digoxin, it causes digoxin levels to increase, which requires close monitoring. Procainamide is another antiarrhythmic that requires attention because both the parent drug and its metabolite, known as NAPA, must be monitored. Disopyramide is also used but requires careful monitoring. Lidocaine, another agent, has a very short half-life, which means its levels fluctuate quickly. Now let's look at anticonvulsants. Phenytoin, also known by the brand name Dilentine, is highly protein-bound, which influences its free concentration in the blood. Phenobarbital is another anticonvulsant that induces liver enzymes, thereby increasing the metabolism of many drugs. Valproic acid is important to remember because when combined with phenobarbital, it can increase phenobarbital levels. Primidone is another drug where both the parent compound and its metabolite, phenobarbital, should be measured. Finally, other notable anticonvulsants include carbamazepine and ethosuximide. Among the psychotropics, tricyclic antidepressants are important to monitor. Amitriptyline is metabolized into nortriptyline, and imipramine is metabolized into desipramine. Both metabolites can also be given separately. Doxepin is another tricyclic drug in this group. For monitoring, immunoassays measure the total drug, meaning both parent compound and metabolite together, while chromatography techniques such as liquid chromatography and gas liquid chromatography can measure the parent and metabolites separately. Lithium is another key psychotropic used in the treatment of bipolar disorders. Monitoring methods include ion-selective electrodes and atomic absorption. Theophylline is a commonly monitored bronchodilator. Signs of toxicity include nausea, vomiting, headache, irritability, and insomnia. In severe cases, it can cause cardiac arrhythmias, seizures, and even death. In neonates, caffeine acts as an active metabolite of theophylline, so monitoring levels is essential. Immunoassays are often used, with separate assays for theophylline and caffeine, while liquid chromatography can monitor both simultaneously. Caffeine itself is sometimes given directly to neonates as therapy, making its monitoring clinically significant. Immunosuppressants are vital for preventing rejection after organ transplantation. The commonly monitored drugs include cyclosporin, tacrolimus, sirolimus, and mycophenolic acid. These agents are often used in combination therapy. For specimen type, whole blood is the preferred sample for most of these drugs, with the exception of mycophenolic acid, which can be measured in serum or plasma. In some cases, a single trough level is not enough, and multiple samples are needed to calculate the area under the curve, which better reflects total drug exposure over time.